Hello, and welcome to this month's Diagnosis Download, brought to you by the APTA Oncology Section Student and New Professional Subcommittee. Today we're going to be talking about leukemia. Leukemia is a disorder arising from abnormal blood cell production in the bone marrow. It occurs due to a genetic defect arising in the stem cells that normally mature into healthy blood cells, including red blood cells, white blood cells, and platelets. These defective stem cells are called leukemic cells and can proliferate into billions of damaged cells called leukemic blasts that can spread throughout the body. As a result, this cancer can lead to systemic involvement, including but not limited to the central nervous system. Leukemic blasts grow and survive better than normal cells, causing suppression of normal blood cells, leading to anemia, neutropenia, and thrombocytopenia. There are a variety of forms of leukemia. However, there are four major classifications based on the type of cell involved and the speed of growth. The four major subtypes of leukemia are acute myelogenous leukemia, acute lymphocytic leukemia, chronic myeloid leukemia, and chronic lymphocytic leukemia. Acute leukemias are the most aggressive and require immediate intervention to halt the progression of the disease with an ultimate goal of entering remission. Chronic leukemias are generally slower growing and, although they require prompt intervention, are easier to treat and manage with improved survivorship. Most of the signs and symptoms, such as fatigue, anemia, shortness of breath, frequent and/or prolonged infections, excessive bleeding and bruising, fevers, night sweats, and bone pain or abdominal pain localized to the spleen, can be associated with the body having abnormal or reduced functioning of blood cells. Due to the variety of different types of leukemia, treatment type is highly dependent on the subtype, staging, genetic markers responsible for the defects present, as well as the patient's age and general health. Treatment begins with induction therapy, with the ultimate goal of entering remission. This is accomplished through use of a combination of chemotherapies, and sometimes immunotherapies, to remove the bulk of disease cells. Following induction therapy, the patient will continue with consolidation therapy, with the goal of completely eliminating all residual leukemia cells. This is accomplished with continued chemotherapy, stem cell transplantation, or immunotherapy. Stem cell transplantation is unique in that patients receive either their own healthy stem cells or donor stem cells, with the hope that these engraft and become the new healthy blood cell generating system. These treatments come with the potential for adverse side effects that can negatively impact mobility and physical function, ranging from cancer-related fatigue and cancer-induced peripheral neuropathy to emergent life-threatening syndromes such as graft versus host disease, tumor lysis syndrome, differentiation syndrome, and cytokine release syndrome, all of which would require immediate hospitalization. Once patients complete these treatments, they are followed extensively with regular checkups to ensure remission and quickly identify relapse. If relapse occurs, patients will repeat these cycles and sometimes consider clinical trials inclusive of further combinations of chemotherapies, transplants, and immunotherapies, dependent on the extent of relapse and appropriateness of the trial. Leukemia is a pervasive disorder. About every 3 minutes, one person in the United States is diagnosed with a blood cancer, and just under 400,000 people are living with or in remission from leukemia in the US. Thus, it is highly likely that the physical therapists across all settings may encounter patients with leukemia at some point throughout their continuum of care. These patients carry a unique set of challenges that PTs must be aware of in evaluating and treating these patients. In general, these patients will have reduced capacity for activity due to side effects of active disease affecting blood counts or from side effects of their treatment course. Common impairments include poor balance, endurance, sensation, and strength, which contribute to overall movement system impairments that require PTs to assist in correcting and optimizing movement and function. Special consideration must be given to those with active disease and those receiving chemotherapies, as their low blood counts place them at increased risk for bleeding, bruising, injuries due to increased resistance, infections, and potential syncope with exertion due to low oxygen carrying capacity. Physical therapists play an important role in the oncology care team for patients with leukemia. We assess for symptoms related to the disease process or treatment course that impact function and provide thoughtful and appropriate interventions to address those impairments to increase quality of life. We also provide a unique opportunity for optimizing physical fitness prior to extensive and difficult treatments to improve outcomes of these treatment regimens, as well as provide education on long-term physical activity programs for improved quality of life of survivors. In summary, PTs optimize function and quality of life for patients with leukemia through the entire spectrum of their cancer journey. Physical therapy expertise is utilized to identify specific impairments and create appropriate and safe exercise programs based on the unique presentation of leukemia and the accompanying varied treatment side effects to improve function and quality of life throughout survivorship.